You're welcome to introduce yourself in the chat. And in just about a minute, I'm going to go ahead and get started. I already have a few people with us today, which I'm so excited. Okay, I'm going to go ahead and get started. Good afternoon, everyone. For those familiar faces in the audience, hello again. For those new faces, welcome. My name is Kendall Lee. I am the Program Administrator of the Maryland Emergency Preparedness Network. The EPN is an emergency preparedness communications network operated by the Maryland National Capital Home Care Association, otherwise known as MNCA, in partnership with the Office of Preparedness and Response within our state's health department. And we provide emergency preparedness education, training, and resources to home and community-based healthcare providers, patients, and their caregivers. I'd like to extend my gratitude to Minka and the staff at OP&R for their ongoing support, and their invaluable partnership is what makes programs like these possible. So we thank you. I am incredibly excited to introduce both our topic and our guest speaker, but before I do, let's just cover a few housekeeping tips. Today's webinar will be recorded. You can expect to receive a copy following today's event. In terms of the audio and camera portion of today's event, you will have complete control over your own microphone and camera settings. And while we kindly request that participants remain muted during speaker presentations, we certainly welcome you to unmute during any Q&A portions of today's event. Additionally, attendees are warmly invited to activate their cameras to connect with us today, though it is not required, of course. And as for the Q&A, we certainly encourage questions. You're invited to place your questions into the chat, which will be closely monitored today by yours truly. And now I can't wait to introduce our topic and our speaker. So, in recognition of Older Americans Month this May, we are hosting this webinar today. And this month is a time to truly honor the strength, wisdom, and lifelong contributions of older adults. It's also a call to action to make sure the people who have cared for us are protected and informed and supported. So, while older adults make up a smaller portion of poison-related calls, which Emily will speak to shortly, to the Maryland Poison Center, they are more likely to experience significant health outcomes when something goes wrong. And that's why prevention and awareness and knowing when to call the Poison Center is so important. So today's session is all about equipping you with those practical steps to reduce risk, have clear guidance on what to do in an emergency, and the confidence to act when it matters most. Whether you're an older adult, a caregiver, a family member, or a professional, your role in this is vital, and the Poison Center is here for you. So with that, I'm really excited to introduce our guest speaker, who will teach us how we can all play a part in preventing poisoning and promoting safety for the older adult community. And without further ado, I'm excited to introduce and welcome back our guest speaker, Emily Patterson from the Maryland Poison Center. She serves as the Public Education and Communications Manager at the MPC. So Emily, thank you. Welcome back. We're so grateful to have you, and the floor is officially yours.
Thank you so much. For those who I haven't had the pleasure to speak with yet, it's nice to virtually meet you all. And I will get started with my slides in a minute. There we go. Does that look correct? Oh, is it loading? Good. Okay. Awesome. All right. Well, as Kendall said, my name is Emily. I'm the Public Education and Communications Manager at the Maryland Poison Center, where I've worked for almost 7 years, and I'm happy to speak with you all today about poison preparedness and prevention, and talking about different risks associated with older adults when it comes to poisonings and overdoses. Also to speak to the caregivers of older adults as well. So you can take this information for yourself and share it with others in your community too. All right. So today, I'm going to briefly talk about what a poison is, which can be a lot of things. I'm going to go over the who, what, where, when, and why of the Maryland Poison Center. And then we'll get into our content talking about common poison exposures for older adults, reducing the risk of poisonings for older adults, and all of the resources that we have available for older adults and their caregivers. So, for those of you who have heard my whole presentation spiel before, I apologize. But there is a little bit of a change in there, so I will note that. And then, of course, for those of you who aren't as familiar with my education portion. So, I always like to start my presentations by defining what a poison is so that we're all on the same page. So, as you can see here, a poison we define as anything used in the wrong way, in the wrong amount, or by the wrong person. And there's a lot of different examples of categories of poisonings here on the screen. So we manage medicine, misadventures, and misuse. We talk about over-the-counter versus prescription versus like vitamins and supplements. Um, and we cover our household cleaning products, our personal care products. We also cover bites and stings from venomous creatures. We do have one venomous spider in Maryland, which is the black widow spider. And we do have two venomous snakes in Maryland, which are the eastern copperhead and the timber rattlesnake. So those are three venomous creatures that are native to Maryland. We also cover things of all other bites and sting nature, bees, wasps, jellyfish if you're down on the shore. So all different types of bites and stings from creatures. We also cover plants, berries, and mushrooms, things like food poisoning from either private or public establishments. We cover substances of abuse and chemicals. And I also like to mention here and note that poison is not just something that could be swallowed or ingested. It's also things that can come into contact with our skin and dermally poison us, also through our eye for ocular exposures and also inhalation exposures. So not just those swallowed poisons, we have to think about the other types of poisons too, the other routes of poisoning. And then, of course, I'll talk a little bit later about intentional versus unintentional. So we see things that happen unintentionally, a total accident, didn't mean for it to happen, but we do see some intentional exposures as well. All right, so why do poison centers exist? So there are 53 poison centers across the country, and we exist because poisoning continues to be the leading cause of unintentional injury death in the United States, and that's for all age groups. Each year, there are over 2 million human exposures reported to the United States poison centers, and this has continued. It's been around the 2 million mark for the past few years. So over 2 million humans came into contact with a poison across the country in a year. And although we're not talking about kids today, it's always interesting to note that approximately 40% of those cases, those 2 million cases, occurred in children under the age of 6. So children under the age of 6 are a large portion of calls and cases at poison centers, but they're not the only ones. And I'm really happy to talk about older adults today and kind of shine an important light on them. And obviously, many more poisonings are unreported. It's not a requirement to report anything to the poison center. So there are many things that happen that we don't know about as well. All right, so this is our new and exciting slide. So for those of you who have heard my presentation before, this is different. So the Maryland Poison Center is now the certified regional poison center for the entire state of Maryland and the District of Columbia. Previously, we only served 22 of the 24 jurisdictions in Maryland. So we did not used to cover Prince George's County and Montgomery County. So I'm very happy today to say that I now cover the entire state, and it makes my presentations a little bit easier to explain in my communications and contacts with people across the state. So the whole state of Maryland and the District of Columbia are now served by us following the closure of the National Capital Poison Center, which was in DC. Maryland Poison Center is hosted at the University of Maryland School of Pharmacy. While we are located here, we are a phone service, so we do not see any sort of patients or treatment or testing in person. Everything is strictly over the phone. So it's all managed by that 1-800 number. We don't see anyone in person. And we've been around providing poisoning treatment advice, education, and prevention to Maryland since 1972. Who is the Maryland Poison Center? So our main stars of the show are our pharmacists and nurses with specialized training in toxicology, which is the study of poisonings. And these pharmacists and nurses come to us with a certain background in healthcare, and then they train here at the Poison Center for a certain number of time or certain length of time and manage a certain number of cases in order to sit for the national exam to become a certified specialist in poison information, or C-SPI. So if you hear me say specialist, spy, C-SPI, poison expert, all of those things, this is all the people that I'm referring to. It's the same thing, those pharmacists and nurses with that special training to be able to manage these calls. And to back them up, we also have board certified clinical and medical toxicologists that help with our medical direction here. They talk a lot about our guidelines for the different exposures that happen, and they are there as backup when more complex cases come across. Public educator, that's me, party of one. So I go around the state educating the public about the Poison Center and also about prevention. So a perfect example of that is like the program we're doing here today. I also do health fairs and different trainings as well. Our health professional educator is being a shared role right now, but that is for our healthcare providers who want more clinical education about toxicology and management of poisons. So you can request a program from them. And then support staff as well. Of course, we have our people in our front office. We have the people who do our mailings of our materials that I'll talk a lot about later. Also our IT specialist who helps us. So we are a very small team. We only have around 30 staff members. So all of these people, most of them are our spies, but we're a very small but mighty team serving Maryland and DC. So when should you call the Poison Center? When a poisoning or overdose happens, it can be very scary, and a lot of people's first gut instinct is to call 911 or go to the hospital straight away. So we're going to talk about some few scenarios here for when you should call the Poison Center versus other resources. So if someone is having life-threatening symptoms, a life-threatening emergency, if they're unconscious, if they're having trouble breathing, you can't wake them up, they're having a seizure, they're having trouble talking or walking, please by all means call 911 and leave that emergency medicine to them. If none of those things are happening, if they're able to talk, breathe, and otherwise be okay, then you'll want to call the Poison Center. And again, we manage things like medicine mistakes, mistakes with personal care products or household cleaning products, bites and stings, plants, berries, mushrooms, all those things we talked about on that first slide. So again, if it's not, if they're not having life-threatening symptoms, go ahead and call the Poison Center. Some other people that you should have in your care team as well, of course, are your healthcare providers. If you have a question about why they prescribed a medicine for you, if you need to ask about when to start or stop taking medicines, and for any routine medical care, that's when you would go to your healthcare provider. And then your pharmacist as well at your local pharmacy, or maybe you have an online pharmacy, mail-in pharmacy. They can help you with generic alternatives to any medicines that you're taking. They can help identify any drug interactions with the medicines that you're taking and give you special instructions when taking medicines. So all four of these categories are those people that are in your corner in your healthcare journey. So to call the Poison Center, it is a nationwide phone number. Again, all 53 Poison Centers use this nationwide number. Theoretically, you should be routed to your local Poison Center based on your physical location. So you would call this 1-800-222-1222 number. If you don't already have us in your contacts on your phone, you can scan this QR code and it will add the contact into your phone contacts. Apologies for my phone conveniently ringing at the moment, if you can hear that. So if calling the 1-800 number, if you need any assistance in a different language, we can connect with interpreters in over 230 languages. And if you are deaf or hard of hearing, you can call us through Maryland Relay as well. So that's our phone number to call. And who can call? So we answer calls not only from the public and not only from healthcare providers. We um, answer calls from everyone. So we have obviously the public calls us from home, from school, from work. We also have first responders who call us from the field using this special phone in the middle that connects a hospital, the first responder in the field, and a specialized care facility like the Poison Center or other ones around the state as well. And we're able to counsel on what to do with a patient before they are transported or while are being transported to a healthcare facility. We also speak extensively with healthcare professionals in a variety of different settings, in home caregiving settings, in healthcare facilities, in just doctor's offices as well. So a variety of different settings that we hear from folks from. So in 2023, 5% of cases originated with an emergency medical service provider. And when they or 911 consulted with the Poison Center on a patient having a poison exposure, 15% of those patients were managed safely at home. So sometimes when the first responder calls us from the field, we're able to triage the situation and let them know that they don't need to go into a healthcare facility, and we'll follow up with them via the phone at home. And I also mentioned our healthcare facilities. In 2023, we had 22.3% of cases that originated in a healthcare facility. So again, all these different types of populations we have call us, not just one or the other. All right, and lastly, before we get into our content for today, talking about our quick facts about how the Poison Center helps. So for those of you who aren't familiar, it's completely free to call. We do not ask about insurance or any sort of money. It is completely free. We are paid through other avenues, and we do not charge for our services. We are available 24/7, 365, no matter what's going on outside your window, no matter what time of the day or what day, holiday it is, we are still open. Calling is confidential. We're not a reporting agency. Some people are afraid to call us because they think we're going to report them to social services or immigration or other agencies, but that's not true. We follow like HIPAA, just like your doctor's office does, and we do not share any of your information with anyone. Calling us is totally non-judgmental. Our pharmacist and nurse, our spies have probably heard it all, most likely heard it all. A lot of these people have been here their entire career, and they have really heard it all. So they do not judge you when you call in for an exposure or a question as well. I already mentioned we can connect with those interpreters. We give specific recommendations to your case. So if you were to Google or search online about your symptoms or what exposure you have, you're going to get very general, maybe outdated, maybe not even backed by a healthcare professional information, not to mention the millions and millions and millions of search results you're going to get by searching the internet. Whereas when you call the Poison Center, you get specific care and recommendations based on the specific things that are happening to you. And lastly, we can safely manage a majority of cases at home or where they occur. So I mentioned with our healthcare providers, our first responders, when they were in the field, we were able to manage some of those exposures at home or where they occurred. And so that goes for the public and just general things as well. So in 2023, we managed 65.2% of cases on site where they happened. So we are not always saying, when someone calls in, we're not always just sending them right to the emergency room, right? We have these guidelines that our medical director and our staff have come up with to safely monitor people at home with follow-up calls. All right, so for our data, in 2024, we managed more than 37,000 cases, and 30,000 of those were human exposures, which is what you'll see here in this graph. Those 30,000 human exposures, which means a human came into contact with a poison. We also managed 700 animal exposures. So we're a human poison center, but people do often call us about their animals being exposed to things. And we will refer you to our pet poison centers. We also manage 6,000 information requests. So it doesn't just have to constitute an emergency to call us. You can also call us for information, ask a question, and we love to prevent future poisonings from happening. So here we are, our 2024 exposures by age. So children under the age of 6, I mentioned nationally was 40%. In Maryland, it's 37%. So the largest portion of our cases do occur in our young children, but there's also all of our other age age breakdowns here as well. So our teenagers, our tweens and our teens, around those 9% marks, are adults 20 to 59 years old, are 29.4% of our cases last year, and older adults were 12.3% of our cases. So I'm going to talk a little bit now about our exposures in older adults. As Kendall mentioned in the introduction, nationally, older adults only account for a small percentage of cases reported to poison centers, but they do account for a larger portions of our major medical outcomes and deaths as well. So here you'll see our poison exposures in older adults. So in 2023, for Maryland, older adults were 11% of our cases, which was about 32,000 cases. Nationally, it was around 10% it was 10% of the cases, which was around 76,000 humans were exposed to a poison across the country. In 2024, that number went up to 12.3% in Maryland, which was around 4,000 cases. And nationally, the 2024 data hasn't been shown yet. So again, talking about the volume is pretty low compared to the other 80–90% of cases reported to poison centers. But again, they do often have more severe medical outcomes due to these poisonings. So we're going to talk about that today. So you may be thinking, what are the most common things that older adults are exposed to and what we hear from older adults about? So this is the top 5 most common exposures for our older adults. This is not 1 through 5 most harmful or most deadly, right? It's just simply the most common things. And when we're looking at our older adults, I do want to note before I go into my list that 75.1% of cases in older adults were unintentional. So they were accidents. They didn't mean to happen. They weren't intentionally doing something. It was therapeutic error, which I'll talk a lot about in a little bit. And you may also see that all 5 of these are medicines. So our older adults and being at risk with the medicines that they take. So that's kind of where the whole poison center thing comes in, right? Because we manage a lot of medicine mistakes. So on this slide, we'll talk about the 5 most common exposures for older adults. So number 1 are our heart medicines. So things that are used to treat conditions that affect the heart and the blood vessels, treating things such as high blood pressure, heart failure, different heartbeats, irregular heartbeats, and high cholesterol. So that is our number 1 most common substance that we hear about for our older adults. Number 2 are our analgesics, which are also called pain relievers. These are things such as over-the-counter acetaminophen, ibuprofen, naproxen, but also things like prescription pain relievers, which also includes our opioids. Number 3 are hormones. These are meds used to treat diabetes and thyroid disorders. So we hear about different dosing errors with their insulin, or maybe they took the wrong dose of their diabetes or thyroid medicine at the wrong time, or they took the wrong one or took the wrong amount. So we hear a lot about that. Number 4 are antidepressants, which are medicines that are prescribed to treat depression and other mental health conditions. And number 5 are our sedatives and antipsychotics. Now, I know this is a little bit of a confusing category here. So these are things such as sleeping medicines, medicines to help with agitation or anxiety. So we see benzodiazepines such as Xanax and Ativan. We also see antipsychotics such as Haldol or Abilify. A lot of different meds that are prescribed to treat various conditions. So now that we know a little bit what we're talking about here, I'm going to go into the common risk factors of our older adults. So this is just kind of the overview slide, and then I'll go into each of them a little bit more extensively. So common risk factors for older adults are therapeutic errors, drug interactions, substance abuse, Their complex medicine regimens and things like we also may refer to it as polypharmacy. We're going to talk about their diminished eyesight, insufficient medical monitoring, and the diminished kidney and liver function in our older adults. So let's take a look at each of these. So for the risk of therapeutic errors we define as something like a double dose, or if they not sure if they took a dose, so they want to take a dose because they can't remember, which could be a potential double dose, or they just need to see if maybe they need just to skip a dose, different things like that. Also, wrong medicine being taken. So maybe they took their nighttime medicines in the morning versus their morning medicines in the morning, right? Which may cause some things like drowsiness. They're going to be a little bit more sleepy, or they need to be careful when they're, getting up out of a chair, or they shouldn't be operating like a car, things like that. So if they're mixing up their different morning versus night medicines. And we also hear a lot about people taking somebody else's medicine. So with older adults, sometimes they live with other family members or their spouse or someone else in the home. Also pets. So older adults sometimes take their pets' medicine or they give their pets their human medicine, different mistakes like that. Also, therapeutic errors can include the wrong route. So say you're supposed to take a suppository and you accidentally swallow or ingest the suppository instead of inserting it where it's supposed to go. So that would be like a wrong route. Also, things like topical medicines, maybe just was, maybe took a lick of it or swallowed it, things like that. So just the wrong route of taking different meds. So how we want to prevent this is using something to remind you that you've already taken a dose today. And if you can't remember if you took your dose today, it's okay just to give us a call. We'll run through your medicine list and be able to tell you what would be okay to potentially take that double dose of, or versus some medicines that would be better just to skip it so that you don't accidentally take too much if you did in fact take the medicine already that day. So we hear a lot about people that just say, I just can't remember if I took it, and that's totally okay and normal, and we're happy to run through that with you. It's important to keep medicines in their original labeled containers. Now, you may know things such as daily pill minders. There's a picture of one in a couple of slides, which are great tools for some, or maybe you have a mail order pharmacy where it just has each day separated out already for you if you take multiple medicines. Which is fine to use those. It just runs some risk, especially if there are children in the home. But if you can, keep things in their original labeled containers so that way you know what it is that you are potentially taking. And like I said, calling the Poison Center for things like therapeutic errors is a very normal thing, and we're happy to help people with that. All right, next we're going to talk about drug interactions. So drug interactions can be many different things. And something I want to note for when we talk about medicines is that when I say the word medicine, I'm talking about a lot of different types of things. I'm not just talking about prescription medicines, right? I'm not just talking about over the counter. I'm talking about all these different things. So when we look at drug interactions, oftentimes people will take multiple different kinds of medicines, such as over the counter, things you can buy at the store, or prescription medicines that have to have a prescription from a healthcare provider and be filled at a pharmacy. But also things like vitamins and supplements that you can buy at the store, and natural and herbal remedies as well. So I'm talking about all these different types of things. So drug-drug interactions can happen when you take two drugs and they interact with each other. Also, things like drugs interacting with the food or drink that we have. So, something in particular, as you see in this picture about grapefruit. So, there are some medicines that you should not eat or drink grapefruit juice while you take that medicines because it can change the way that the medicine works. So, notably things like statins to help lower cholesterol, and the severity of the interaction can vary with these different medicines and the grapefruit juice. Also, things like alcohol. You shouldn't be taking alcohol with some medicines, and you'll also see a similar kind of sticker on your prescription medicines, and it may be, if it's an over-the-counter medicine, it would be in that huge drug facts label in there under one of those subheadings as well. So things that you eat or drink can interact with your medicines that you take as well. So how do we prevent drug interactions from happening? Ask first. So this is something that we use in our children, but it also is pretty applicable to us as adults and older adults as well. Before you start a new medicine, if you're already taking quite a few different kinds of medicines, it may be best just to speak with your healthcare provider before you start taking a new medicine, vitamin, or dietary supplement, just to make sure that there are no precautions that you need to take and that there would be no potential interactions with the medicines that you're already taking in this new medicine. If possible, we encourage people to use one pharmacy to fill their prescriptions. That way, when you have a new prescription, the system that your pharmacy has already checks to make sure that none of the medicines that you're taking will have any interactions with each other. And again, it's important to let your healthcare provider know about all the different medicines you take. On the next page, I'm going to show you a medicine tracker and we'll talk a little bit about that. But again, when I say about all the medicines you take, please make sure that your healthcare provider knows that you're take any of the over-the-counter medicines. If you take, like, say, an allergy pill, right, an antihistamine, that's important for your healthcare provider to know, just to make sure that it's not going to interact with any of the medicines that you're already taking. So make sure that you let them know about all those vitamins, supplements, and different over-the-counter medicines that you take, not just your prescription medicines. Very important. All right, so complex medicine regimens. So polypharmacy is defined as the use of multiple medicines at the same time, often defined as 5 or more. The average number of medicines used for each American older adult is at least 4.3. I think that number is kind of low. I've gone into the community and spoken with some with some community public members, and they tell me that they take 20 plus different medicines a day. So personally, I think 4.3 is a little bit lower on the scale, but it does show you that, a lot of people take a lot of multiple different medicines. So ways to prevent this: using a medicine tracker. So this is an example of our medicine tracker. You're welcome to use any medicine tracker you have. If you don't have one though, I highly suggest you have one. So you can download this on our website. And on a medicine tracker, you would list all the different medicines that you take. And there's other like headings for different important information. Especially, I want to note the reason for taking, especially for our older adults, they often don't know why they are taking the pills that they are taking. So sometimes, or in my education to older adults, I always empower them to be an advocate for themselves and to ask questions. Sometimes it can be a little nerve-wracking. But older adults typically place a lot of trust in their healthcare providers. And so encouraging them to ask questions and know why they take something, not just say, oh, my blue pill's for my pressure, my red pill is for my allergies, like, and not just describing things that way, but really knowing why they're taking what they're taking is really important. So, and with this medicine tracker, something I mentioned on the last slide was about using this or just having some sort of list of the medicines that you take, especially if it's more than 2, 3, right? Just to keep everything straight. And so when you go to your healthcare provider, you can just give them the list of your meds that you're taking and ask them to make a photocopy. That's one of my biggest tricks I have, and I encourage people to do, because at each healthcare provider visit, they ask you to write down all the meds you're taking. And again, with people taking so many different types, sometimes things can get lost. And it's really important for your healthcare provider to know all the different medicines that you're taking. So just find some sort of tracker that works for you, and use it, and be sure to share it with your healthcare provider. Also, to help with the whole polypharmacy thing and just having these complex medicine regimens is to keep your medicines organized. Again, if that is in a daily pill minder, or if you have the mail order daily, different sections, that's totally fine. But if you can keep your meds in their original labeled container, that's also a really great way to keep them organized. All right. So next we'll talk about our diminished eyesight. So we encourage people, before you use any sort of medicine or household cleaning product, to put on your glasses and turn on the lights. This can help you read the label to make sure that you're grabbing the thing that you mean to be grabbing. You can also consider having a magnifier to read small print on medicine labels to help ensure that you're taking the medicine correctly. So it's not just things like medicine where you accidentally take the wrong ones. Again, I was talking about maybe take your nighttime medicines in the morning by accident, but also things with our personal care products. So with our older adults, we often hear mix-ups with toothpaste and arthritis rubs. So if you think about the container that, or the tube, I'm sorry, that a toothpaste is in, it's very similar shape and structure to the tube of Bengay or another kind of arthritis rub, Icy Hot. So sometimes if you're not paying close attention to what you're doing, you could accidentally grab something that you didn't mean to grab and end up brushing your teeth with that arthritis rub. We also hear a lot about different mix-ups with eye drops and ear drops too, because if you think about the containers that they're in, they're very similar to each other, right? So you may put your eye drops in your ear and your ear drops in your eye, or other sorts of things that are in those similar tubes, such as super glue, we hear about. So similar shaped containers. And if you're not having your glasses on and having the light on to see what label of what you're doing, you can make that mistake. But again, it's totally normal and all things that we can help you with at the Poison Center. All right, our next risk we'll talk about is our insufficient medical monitoring. So we really encourage people to get their routine blood work because with some medicines, it's necessary to perform these to make sure that the proper amount of medicine is being taken and that your body is responding appropriately to the medicine that you're taking. And we'll talk a little bit about your kidneys and your liver um, in the next slide. Often these routine blood work tests are skipped or not ordered, which can put the patient at risk if they're not making sure that their body is responding appropriately. And again, here, I'll make the plug for that. You should always make sure that your healthcare provider knows all the different medicines that you take, including all the different types. All right, so our kidneys and liver are responsible for converting medicines into their active forms and removing excess medicine from the body. So they're really what is making things move in there, right? So they play a very important role with the medicine we take. And we're often not aware of our kidneys and our liver function change, unless we get that routine blood work done, or if we just develop side effects from the medicine due to it being built up in the body. So again, not skipping your blood work and making sure that your body is functioning properly with that medicine is very important. All right, so I've talked a ton about medicines, and again, they are our top 5 in our older adults, but let's talk about some other things that we can run into as older adults. So household cleaning products are also a common exposure we hear about here at the Poison Center. So a lot of times people will, when they're cleaning, use multiple products and they end up mixing them. So even things such as if you're using multiple products on a surface, such as the counter or the bathtub or the toilet bowl, if you're using multiple products, you can use one product, make sure it's fully dried or wiped off before you use the next product. You also don't want to mix things together because you can create a gas that makes it kind of hard to breathe, and you would need to ventilate that area and get out of the area to fresh air so you're not breathing in that gas that is created by mixing multiple cleaning products together. Also want to make sure that our cleaning products are being stored safely. So kind of back to my slide about turning on the lights and putting on your glasses is also not just our personal care products look similar to other things. I was talking about like toothpaste and arthritis rub, but also our cleaning products can look like other things as well. So one example I love to share is Comet Cleaner. So if you think about the container that Comet Cleaner is in, it's round and it has these holes at the top, right? All right, can we think about another thing that has that similar container structure? Can anyone think of it as a food item, I should say? You can put it in the chat. If anyone has any guesses, I see one in the chat. Did someone get it? All right, Parmesan cheese and spices. Yes, that's a great example as well. But yes, Parmesan cheese is very similar structure, container structure to that. So if you're storing your cleaners where your food is, it is very easy to mistake that. Another common mistake we get is things such as when people put bleach or other cleaners into a drinking container, and then they don't label that it's not water or juice or soda, it can be very easy for someone to accidentally drink that because it's not labeled correctly. So always keep things in their original labeled containers. Try to store your cleaning products away from your food products. And hey, maybe if you do have your tight on space, you could use something like a Mr. Yuck sticker on your cleaning product to distinguish it against your a food product or a beverage product. And then just in general, when using cleaning products, be sure to open them away from the face or the body, especially if it's something you haven't opened in a while. You don't want to be over top of it when you're opening it. You may not want to spray. If you're fiddling with a spray nozzle on something, try and keep it pointed away from you just so that you don't get in your eyes, in your mouth, or on your skin. All right. Oh, let's see. Okay, outdoors. So we also hear about different poison exposures outdoors as well. So things such as this gentleman is spraying some sort of lawn or garden chemical, herbicide, pesticide, things like that. Being sure that you're wearing appropriate attire. So this guy's got about maybe I would say a 75% passing rate for my liking. So he does have boots on, but he's not wearing any gloves or any eye protection. And so when he's spraying this, it could get on his hands and through his skin, and it could get in his eyes. He's also wearing a short sleeve shirt. So also when you're using these kinds of chemicals outside, you want to wear long sleeves to cover your skin. And again, that eye protection is very important as well. So again, he gets maybe a 60, 75% passing rate here because he's wearing those boots. Also things like pool chemicals, if you're managing a pool, a lot of times the products that you use to balance pools can be irritating to the eyes, the skin, when you inhale. So be sure to open pool products outside in a very well ventilated area, especially if it's been in the cabinet on the off season. Bites and stings, we talked a little bit about this at the beginning, but during the spring and the summertime, when people are out in their yards doing yard work, they may come across different snakes. If they're cleaning out their shed, they may find some spiders or some other creatures. So just being sure to watch around your area when you're working in your lawn or your garden or your shed. And when you're out walking, there is the potential to be bit or stung. And lastly, our plants, berries, and mushrooms. So plants outdoors and indoors, berries that you can find on different trees, and mushrooms that grow outside. All want to take caution and try to stay or know what's in your yard so that you know the potential risks around you. And grandchildren. So there are some multi-generational family households. And so that means that there are older adults living with their children and grandchildren, which can bring some risk to the whole medicine thing. So grandpa may take a heart medicine, which could be very harmful for his grandson to eat or to ingest or to play with. So making sure that you're storing your items safely when you have grandchildren around. I know not everyone is applicable to, but if there are any sort of children or visitors in your home, making sure that you're storing things safely, even if it's just you most of the time, when you have some visitors over, just be sure to store things up way and out of sight so that they can't get into them. And the Maryland Poison Center can be used as a resource for your grandchildren, or when you have your grandchildren in your care. There's also a high percentage of grandparents that are trusted caregivers to their grandchildren while the parents are at work. So in 2023, we did have about 570 cases were reported by grandparents. So using us as a resource when you're taking care of your grandchildren, if your grandchildren get into anything too. All right, I'm going to wrap up here with our different resources that are available to anyone. So first is our website is mdpoison.com. On here, you can find a wide variety of different things, namely our information sheets are under our education tab, our newsletters as well. You can press the red button in the bottom right to receive our newsletter. We have a public and a healthcare professional newsletter. activity sheets if you're interested in teaching children about different things. If you're interested in just like a coloring sheet or a word search crossword puzzle, we have those, and videos as well. You can also order educational materials, and I'll talk a little bit about that in a moment. So this is our older adult poison safety information sheet. You can find it on our website. Here's the short link if you need it. It's bit.ly/older adults-info. And this is just our one-pager info sheet on poison safety for older adults. A lot of the stuff that we went through today. These are two of our educational materials that we use for our older adult population. On the left here is our safe medicine use booklet, and this has a lot of general medicine safety tips, safe storage, safe disposal of medicines. It's a really great booklet to provide for older adults and caregivers. We also have our wonderful magnifying glasses here on the right that we have, and you can order these on our website for free. Right now, our booklets are out of stock. Unfortunately, people love them so much. Kendall and I talked about that the other day, that a lot of people really enjoy this as a resource. So we are currently waiting on our shipment of those, but they'll be back soon. But you can order these on our website, or you can contact me directly for those, and I'll have that information as well at the end. Our other educational materials that are available for order for free in limited quantities are our telephone stickers, our magnets. We have our contact card that has just quick facts of information about the Poison Center. We have our brochure that's available in English and Spanish. And we have an updated version of this that we'll be putting on our website soon. So, but we still have a lot of printed ones of these as well in English and Spanish. In our Mr. Yuck stickers, something that I mentioned a little bit earlier is that you could use Mr. Yuck stickers to distinguish between a cleaning product versus a food product if you're tight for space in your home. But I've also talked to other Poison Center educators about using Mr. Yuck in our dementia patients. So they may remember Mr. Yuck from their childhood, and it may just be another step you can take to remind them that this is a cleaning product or a medicine, and they could see the little face on there and say, and maybe think that they shouldn't be touching that or using it. So another tool that we can use to prevent poisonings in our older adults. I know most of our audience here may be in the healthcare profession, but also if you would like to order a poison safety packet for your home, it has one of each item basically, and you can order that for free to be sent to your home on our website. It was one of those buttons. It says order materials. There's also the short link here. It's bit.ly/MPC packet, and this will be mailed to you after you fill out the little form. And this can be anyone with a home in Maryland or DC. Social media, our Facebook, X, and Instagram is updated regularly. We also have our YouTube channel with our different videos. You can get to know us at the Poison Center. We have some educational videos on there as well. And our blog also, we have a long form content of, like, social media posts are pretty short, right? Like 250 characters. But our blogs are quite long and extensive and do a deep dive on different topics. So there are quite a few older adult topics on there. If you go to our blog, which is blog.mdpoison.com, on the side there's this tag area. You can find the one that says older adults, and you can read all the different blog topics that are relevant to older adults. And with that, I will wrap up with our evaluation, and I'll send this to Kendall as well. If you are so kind to let us know how I did today on this program and any future things you'd want to see in future programs, we appreciate your feedback on that. And with that, we'll take any questions.
Thank you so much, Emily. Tiffany posed a question in the chat and asked, how do we get them in referring to Mr. Yuck? And I popped into the chat how to order a home safety packet and also how to order other educational materials. Emily, am I correct? And those would be the best two places for her
Yep.
to order them?
Yep. So on our website here, this order materials button in the middle will take you to our page. The
Mm-hmm.
first link will be the poison safety packet. And then the second link will be our online store where you can order a limited quantity of these items. And you can just
Mm-hmm.
go through and it would be mailed to you for free. If you're an organization that needs more if you're doing like a health fair event or you want to give them away, you can also send me an email and I can coordinate that order for you as well. But the easiest thing to do is head over to our website and click that order materials page. Great question.
Awesome. Tiffany, do you feel that your question was answered? Give a little thumbs up.
Yep.
Okay, great. Tiffany said that she will email you. Emily, is your email oh, it's right there. Okay. It's right at the bottom of the question. I just wanted to make sure.
Yeah, I can put it in the chat as well. It's E Patterson. It's very long. Um, there we go. And my
This is
last name is
awesome.
only spelled with one T. So if you put two T's, normal spelling, I probably won't get it.
Thank you for sharing that. Does anyone else have any questions before we begin to wrap for the day? Just gonna give everyone a moment. And thank you, Emily. I'm like, you did such a
Thank
great job.
you.
This is wonderful.
I hope if you haven't heard about us before that you learned
Yes.
much today. And even if you have heard about us before, I hope you learned something new today as well.
Yes, I'm always curious for those who have not been connected to the MPC if this is their first time because it's a wonderful resource to have that's accessible. Okay, well, it looks like we do not have any further questions at this time, so I will begin to wrap up for today. As we begin to wrap up, I want to extend my gratitude to Emily again for sharing her knowledge and expertise. We're so grateful. We hope that today you walk away with new information that can support your poison preparedness. To our attendees, I want to thank each of you for your presence and participation and engagement today. It's what makes these sessions meaningful and impactful. So thank you for being with us. If you have any further questions or are interested in any additional resources, please do not hesitate to reach out to me. Our EPN email is provided in the chat, and you'll also find the contact information for the lovely Emily, our speaker, which she generously provided in the chat as well. And following today's presentation, you can expect to receive a copy of the recording alongside a handout and some additional MPC resources to support you and caring for older adults, as well as an invitation to complete the survey because we'd love to hear from you. So thank you so much, everyone, for joining us, and I hope that you have a wonderful rest of your day. Until next time, thanks, everyone.
Thanks all.
You're welcome, you're welcome, you're welcome. Yay! I'm grateful.
Thank you so much.
Thank you.
Of course.
Mm, mm, mm.